Portion of Daytime Tri-Cities is sponsored by State of Franklin Healthcare Associates. For this week's edition of Meet Your Provider with State of Franklin Healthcare Associates, we want to introduce you to Dr. Kent Wright. Dr. Wright is currently the medical director for the State of Franklin Healthcare Associates walk-in clinic in Johnson City. In addition to being the administrator of the walk-in clinic, he is truly dedicated to seeing, treating, and providing exceptional health care for his patients on a daily basis.
So I chose to become a doctor because I was absolutely fascinated with the opportunities it presented. Your heart goes out to patients that need you, and especially in emergency medicine, the field that I specialized in. They come to you with great needs. They come to you in a lot of times great crisis, and whatever you can do makes a giant difference for them and their family. I was also truly fascinated with the people that chose to serve them. I can tell you that people that choose to serve patients in emergency medicine, in any form of medicine, have dedicated much of their lives to do so. They stay up late, they get up early, they forego many of the things that people that are not in medicine get the opportunity to do. They make great sacrifice. They are truly dedicated people.
Over the years, Dr. Wright has seen many changes in his chosen profession.
So I really began medicine in '94. That's when I started medical school. And there have been extensive changes to medicine since that time. I would say the biggest change has been one that's been fairly recent, and that has been the broad implementation of best practices. Medicine is a very researched and studied discipline. And there are people all over the world trying to figure out what is the best way to care for their patients. With the advent of the internet and the implementation of computers and electronic order sets,
Dr. Wright says that technology has made the care of his patients safer and more efficient.
It's made it a lot safer, for one thing. When we prescribe medicines, before we do so, we're given a list of medicines that may interact with the one we're proposing that we give a patient. In addition, we are prescribing doses for that medicine that have been researched and studied and made safe.
But what is a typical day for this doctor?
I have two normal days. I have a day that I really enjoy, and that's the day when I serve patients directly at the bedside. I love to do that. I love to hear their stories, and in addition to doing my best to care for them, I love to make their lives as good as possible. Another day that I do is when I serve the people that I work with here in our clinic, and that is to try and make their work easier, to try and make their work better.
For Dr. Wright, the future of medicine looks to be a bright one for the people that matter the most, his patients.
We've really come a long way, and I think that if there's anything good that came out of COVID-19, it has been our ability to communicate with partners in healthcare on a global basis. We have adopted strategies for communication and implementation of best practices all over the world that allow us to be right on the cutting edge, no matter where we're at, and make the most of our efforts to care for patients. So I think that is going to continue in a big way. As I said, medicine is a very highly researched discipline, and the efforts of those that seek to find out the very best way to care, for example, a patient that's had a stroke or a patient that has even something as mundane as a rash, will continue to improve and evolve, and we'll do better and better at implementing those best practice strategies everywhere.
Dr. Kent Wright, this week's Meet Your Provider with State of Franklin Healthcare Associates. The preceding portion of Daytime Tri-Cities was sponsored by State of Franklin Healthcare Associates.